Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat, and today is another episode of Behind the Sessions. Today, I'm going to be talking about how people can sometimes feel disconnected from their pregnancy, disconnected from the baby in utero. And I think this is an important topic because a lot of people feel this way, but not a lot of people talk openly about it. Again, I've talked on here so many times about the pressures of shame and that people feel when they are not living up to this idealized standard or idea of what pregnancy is, quote unquote, supposed to be, how you're supposed to feel, what that means about you, and so on and so forth. So when people run into this idea that there's shame and that people feel when they are not living up to this idealized standard or idea of what pregnancy is, quote unquote, supposed to be, how you're supposed to feel, what that means about you, and so on and so forth. So when people run into this idea that they're supposed to feel great and wonderful and glowing and grateful and all of these things, but they don't actually feel that way, it can add to feelings of shame. It can add to feelings of isolation. It can add to feeling like they need to hide who they are. No, sorry, scratch that. Hide how they feel from people around them for fear of judgment and all of these just really painful things that people are trying to hold while they're not feeling well. There are a lot of reasons why people can feel disconnected from their pregnancy and disconnected from the baby in utero. And if this is something that you are experiencing or have experienced, you can see if some of this resonates for you as I talk through it. And of course, I can't represent everybody's experience in this, whatever, 20 minutes, but hopefully some of it can at least help you feel seen or heard or less shame if that is something you're feeling. And for some people, it can feel like there's an emotional distance between you and your baby, you and the pregnancy. For some people, it can feel like they're watching their pregnancy happen from the outside, that other people are responding to them. So they're getting feedback from other people about what they think the pregnancy is. And that might not align with how you feel internally. And then certainly, as I mentioned before, there's shame, there's guilt. There can also be confusion as to why you feel this way or why you don't feel the way you think you're supposed to feel. And again, if that is you, or if you know somebody who's gone through this, you are not alone. You are not broken. There's nothing quote unquote wrong with you, who you are. This is an indicator of something that you're going through. Having this disconnect, having this distance is an indicator that something is going on. And again, there are a lot of reasons that you could feel this way. So I'm going to go through a couple of them. And as we're exploring a little bit about what that is, you could feel fear about what this pregnancy is and what it means. You could have a fear of loss, of perinatal loss, especially if you've been pregnant before and had a loss before. Pregnancy after loss can bring a lot of anxiety and a lot of worry, understandably. You could be experiencing depression, which makes you feel disconnected from a lot of things, including from yourself or from the pregnancy. Or there could be some unprocessed trauma from your past that is, for whatever reason, showing up in this way during pregnancy. It could also be like an unprocessed relational trauma. Like, for instance, if you had a disconnect from your own parent, your own mother, those themes could show up in pregnancy or postpartum for you as well. So one of the common reasons that people feel disconnected from pregnancy is fear. Then again, there are a lot of reasons why people could feel fear. That could be from, as I said before, that you've experienced a loss, that you know how fragile pregnancy can be. And it's very natural for your brain to want to protect you from that in the way that fear can feel like a protection, like you could avoid thinking about it. You could be the opposite of that. You could be hyper vigilant and looking for every single sign possible. Sometimes it could be both. You could be like holding your emotions at arm's distance and just trying to not let stuff in, and therefore staying disconnected from how you feel and from the pregnancy because of that. But fear can also take that opposite route where you're noticing every pain in your body, every time you feel a shift or something different. You could be worried that I've heard a lot of people express that I'm nauseous, so that means I'm okay, and wanting to make sure that they're always feeling bad in a way, because that to them could be a sign that their pregnancy is still viable. But even though you can be hyper vigilant about symptoms, it could still be that you're holding the pregnancy at a distance because of that fear, if that makes sense. And a lot of this is self-protection. And it's not wrong to be doing this. It's a kind of a really natural response to fear of something bad happening, especially if something bad has happened before. Or you could have heard stories. For instance, if you're a woman of color and you're hearing maternal mortality statistics, or you're hearing about something that is bringing a fear related to this pregnancy, that could be another way that you're holding it at distance because it feels overwhelming. But what I want to make very clear is that this fear, this distance, this arm's length, it doesn't mean you don't care. As a matter of fact, it's often opposite of that. You could care very much, and that's why you could be feeling very vulnerable. And feeling that vulnerable can also be terrifying. I've talked about this so many times, how big of a life transition this is. And I'm not saying all this to induce fear or induce anxiety. All of this is to really lay out that if you're having this experience, it's understandable, and you might want to know why. You might want to look into getting support, because when we're disconnected from our pregnancy and also disconnected from ourself and what's going on for us, it can also feel hard to want to know more. It can feel hard to want to get help, because if that avoidance is there, you're trying to keep it at a distance for a reason, because it's too much. It's too overwhelming. But actually learning about it and figuring it out and getting support and getting validation and all of that is what helps tampen down that anxiety. So you don't necessarily have to have had a pregnancy loss to experience this. You could potentially have had a history of depression or history of anxiety that is now showing up during pregnancy, obviously postpartum as well. So if you have a history, that is a risk factor. A history of anxiety, depression, or any other kind of mental health condition is a risk factor for experiencing it during pregnancy, during the IVF process, after loss, in postpartum. But you could be experiencing it for the first time in pregnancy, and not having had a history of anxiety or depression and then experiencing that in pregnancy for the first time is a lot to try and figure out. You don't know what's what. Some people will conflate or make it could seem like they're the same thing. Oh, I feel this way. Maybe that's just how pregnancy feels. If you don't have your own history of understanding what depression and anxiety feel like, what pregnancy feels like for you, it's hard to tease that apart and know what's what. So again, another reason why it's useful to go talk to somebody who understands these things. But again, this could be an indicator. It's something that we say in the specialty is that anxiety and depression are common, but they're not quote unquote normal. It's not something you're supposed to be feeling, but it is something that a lot of people experience. And one of the things about anxiety and depression is that it takes a lot of energy to be living in that. It impacts your body, it impacts your mind, it impacts just your day. And to keep pushing through, to keep doing whatever it is that you need to be doing while having those symptoms of sadness or a low mood or lack of motivation or difficulty concentrating, or if you're feeling worried about everything, or if you feel like you have a shortness of breath, or your body feels on edge. If you have all of this stuff running in the background, it takes a lot of energy. So people feel exhausted by this, and it can in some way not leave a whole lot of emotional energy left for connection. Like lit- if you're literally trying to be connected to your pregnancy and your baby, pushing through all of that to get to that connection is just that much harder. I want to pivot a little bit to this idea of how past trauma potentially infecting. I want to shift a little bit to the idea that past trauma could be affecting this feeling of disconnection. Um, and maybe if that's you can't quite put your finger on why you feel distant, but you just do. And specifically for trauma, that feeling of disconnection or distance or watching something from the outside is is a symptom, a potential symptom of trauma, that you have experienced trauma or you're being activated in a way that you are re experiencing in some way, some bit of trauma. And because life transitions in general can stir up old feelings, even stuff that maybe you did go to therapy for and you did process, every major life change has the potential to bring up a past trauma that has some connection to what you're going through now. So it can stir up old feelings, even for things that feel like long, long ago, long buried. I don't like that, just long ago. It could be some form of childhood trauma. That could be a relational trauma. If you had a parent who was emotionally abusive or distant or cold, it could be past sexual trauma, either from childhood or any time in life. I already mentioned previous pregnancy losses, which are often traumatizing, even if not meeting full criteria for a PTSD diagnosis. That doesn't mean things aren't traumatizing. Um, you could have had previous medical trauma. So now going to doctor's appointments and things like that could be activating a lot of stuff for you. And this and many other ways that trauma shows up could quietly be, or not quietly, be shaping how you feel in your body, about the pregnancy itself, about the baby. And if in particular you're having feelings of unsafety that are being brought up that are related to your body, it is a common sort of effect that you would want to have distance from experiencing your body. So this could be shutting off yourself from, in some way, from the changes that your body is going through, from the feelings that you're having related to growth of the baby or changes in your body. So, yeah, if your body doesn't feel like a safe place, then connecting with your pregnancy can feel really hard. And as I mentioned before, sometimes this disconnect happens because you're trying to potentially protect yourself from something that you haven't fully named yet. You haven't put your finger on. And if that resonates for you, if any of this resonates for you, in particular with trauma, this is definitely a place to go to therapy to work through and to understand. It's vulnerable work, it's tender work, it's difficult, but you don't have to figure it out alone. You don't have to tread through all of your feelings and try and make sense of it yourself. Certainly, in some ways, try to figure out, like, your brain could just be like spinning around on what is wrong, quote unquote, wrong with me. Why do I feel this way? But it is also helpful to get perspective and to have somebody help untangle that with you. Definitely, obviously, I recommend therapy, trauma informed therapy with a therapist who has training in some type of trauma work. It could be EMDR, it could be somatic experiencing. There are many different types. But if you don't have access to that, or that's not on your game card right now, You can try journaling. And certainly, I think the most important thing, even if you don't get to any of this other stuff, is how you talk to yourself about it. And that is exactly why I'm talking about it today. So we can just have it out there, name it, resonate with some of this if it resonates for you, have maybe a little bit of a deeper understanding of why you feel the way that you do, and be able to have a little bit more compassion for yourself. So shifting from what's wrong with me to something's going on. Something's going on with me. I feel this way because something is going on, not because you're a bad person, because you're already a bad parent, because whatever. There could be a million different ways you judge yourself about this. And so it's hard to push through that and offer yourself a little bit more compassion, a little bit more understanding, even just curiosity. Oh, I wonder why. Not what's wrong with me kind of curiosity, but why do I feel this way? What happened or what is happening that is contributing to this? Because this is not who you are. This is what you're going through. And that is a message that I try and really bring home as much as possible. Any of the stuff that we have ever talked about on this podcast is about what you're going through, but we've been taught to internalize things and be self-judgmental, and the messages that have been internalized from the outside are this really idealized version of what it is to be a human. That's just not it. That's not really, we are complex, we are complicated, and that is normal. That is normal. So why not try and inject a little bit of understanding and compassion into this? Really important part of this feeling of disconnect during pregnancy is that people can start to wonder if this disconnect is going to dictate what type of parent they're going to be or how they will be connected to their child for forever. And I want to reassure you that it does not mean that. It doesn't mean that you are going to be a distant parent necessarily. Again, like big old parentheses here. If you get help and support, that helps your process and your journey so that you can have connection. So the disconnection now during pregnancy doesn't predict what kind of parent you'll be. What it does mean is that something needs attention, something needs healing potentially. And a healing can happen gradually. Connection can happen gradually. You can build that. Any relationship, those take time. They take time to build your connection, to understand each other. It's not so much a reciprocal relationship in the beginning there, but there is some way that you guys, you and your baby, can be connected in really beautiful ways, even if you felt disconnected during pregnancy. And one of the ways to get there is by treating yourself better. That idea that I'm a bad parent, I'm a bad person because I can't connect with my pregnancy or I can't connect with my baby actually keeps you more disconnected. That like shaming yourself does not help this. It does not heal this. Curiosity, compassion, understanding, learning, working through, getting skills, that's what helps it. That's what can get you the connection that you want to have, or if you don't have that feeling of wanting to have that yet, can help develop that for you. So in talking through this, I may have said some things that brought up some feelings for you or resonated, or hopefully helps you feel understood and maybe even motivated to get help if that's what your path is. And again, if any of this resonated for you, I hope that you give yourself permission to explore those feelings with curiosity rather than with judgment. And if you are experiencing any kind of mental health condition during your pregnancy, or even if you're not sure, you can go to postpartum.net and look through their resources. You can grab a support group that's free. You can look through the therapist directory. You can look in your local community for resources for people who are experiencing stress during pregnancy. You can reach out to one person in your life and just you could tiptoe into this to begin to feel a little bit more comfortable talking about it with somebody who can hold space for you and with you. So I'll wrap up there for now. And certainly if you know of anybody who's experiencing this, please send this to them. even if you know of somebody who has experienced this in the past, you can send this to them as well. I believe that healing is available at any time, even if it's for something that happened in the past, even if it's you had a pregnancy that you felt disconnected from and you're still holding guilt, you're still holding shame. Oh my gosh, you don't need to live like that. You don't have to continue to hold it. You can work through that. You can get to a place where you can live with a little bit more compassion and understanding for yourself. So healing is always available. It doesn't matter when you experienced this, if you did. And I'm not just talking about this, I'm talking about everything you've ever experienced. If it still has a hold on you, if it's still impacting you, if it's still something you like think about in your mind and you have some guilt and shame over, healing is still available. Get the help, get the support, and try and be free of some of that. So thank you so much for joining me today. If you haven't yet joined over on YouTube, go there and subscribe. You can see all of these interviews. You can see my chats with you. And certainly on whatever podcast platform you're listening on, make sure you're following, you're subscribed, so that you get all of these episodes delivered directly to you. Thank you so much for being here. Until next time.